we will start our session now. So today is past quarter 21 free CPC prep. Hi Ajra, welcome back. And SDS session 7 nervous system coding with scenarios. Good evening Supriya. I hope this session is very useful for you. So without any delay, we will start now. So most of the people from yesterday came now. So Neeraj did not come and Shivkumar did not come. No worries. They can watch our recording. So first we will check nervous system index. So whenever you code or whenever you prepare for CPC or CPT while coding also, we need to have good idea of anatomy. So while doing surgery coding or CPC preparation exam, if you don't have any word, you need to use the Google and find it the correct answer. So why means if you see one thing at several times, so we can remember. See, this is our nervous system chapter, but I am using 2022 version. If anyone has the 2023 color version, please send it to Vincent Medical Coder. So next session onwards, I will use that book. So I have 2023 book, but it is black and white. So I don't like black and white as it is not PDF even. So I thought I need to use color book. Okay guys, so in nervous system we have codes 61,000 to 64,999. So first we will start with skull, meninges and brain. Next we have under skull, meninges and brain we have multiple procedures. So like injections, twist drill, craniectomy, craniotomy, endovascular therapy, surgery for aneurysm, arteriovenous malformation, vascular disease, steroidactic guide, neurostimulators, repair, neuroendoscopy, cerebrospinal fluid. Guys, if the people who are writing CPC exam, you need to familiar with all these sections. So if you are familiar with your CPT book, you will be write the exam very good. So what means you know where are the guidelines are located and page numbers you can remember so that you can write easily. So you need to remember that while writing CPC exam, what are the procedures in spine and spinal cord. If you see, we have multiple number of procedures, injections, catheters, reservoirs, endoscopic, herniated, like this. So you need to remember all these headings. Basically, what are the procedures included in spinal procedures? So we'll go down, laminectomy, stereotactics, radiosurgery, neurostimulators. So we need to know the anatomy also here. So this is the brain, cerebellum, spinal cord. This one spinal cord, brachial plexus, muscular cutaneous nerve. N means nerve here. Here radial nerve. So N means nerve. Intercostal nerves with ribs, subcostal nerves. So inter means in between or sub means under. Lumbar plexus, median N means medial nerves, femoral nerve, pudendal nerve, sciatic nerve, tibial nerve. So basically those nerves also are created using the arteries or veins names. Like if you take radial artery, you can find here we don't have radial nerve. So if you find tibial artery, you can have tibial nerve. So we have multiple procedures here. So basically we need to understand this anatomy. So now directly we will go to our session. So past quarter 21 free CPC prep and SDS session 7 nervous system coding with scenarios. So get ready guys. So question 1. The patient is a 44-year-old female who is undergoing a removal of previously implanted Medtronic pain pump and catheter due to possible infection. The back was incised. Dissection was carried down to the previously placed catheter. There was evidence of infection with some fat necrosis in which cultures were taken. The intrathecal portion of the catheter was removed. Next, the pump socket was incised and the pump was dissected from the anterior fascia. A 7 mm Blake drain was placed in the pump pocket through a stab incision and secured to the skin with interrupted proline. The pump pocket was copiously irrigated with saline and closed in 2 layers. What are the CPT and ICD-10 CM codes for these procedures? So first one is 62365 modifier T85.898A Z46.2 B62360 modifier C62365 modifier 36590 and I97.42 T85.898A. So you need to check the keywords first. First read the operator report clearly. You need to identify the keywords. After that you can check the codes. So now it is 9:41. I will give you 4 minutes. We can discuss the answer at 9:45. Go ahead guys. Start testing. So if anyone has the CPT book 2023 version, please share it with me so that I can use that book now. Guys, even facing repeated voice of mine, or one quarter has the, she is telling that she is getting repeated voice. Is it fine or not? Okay, good Harish. Thank you Azra. Thank you Rohit. So Supriya, all are fine Supriya here. So all are getting clear. So I think you need to adjust from your side. You need to check audio sounds from your side, Supriya. Yeah, great, great. So go ahead with Supriya. This is easy one only, but looks like it is complicated, but very easy one. Guys, all of you try yourself. No need to sit idle. Just write any one answer. Srinivas Reddy, you need to write A, B, C, D. Not one. I don't think one is suitable here. So write A or B or C or D. Guys, there are no negative marking in this session, so you can write any answer. You no need to worry about the markings here. So guys, now it is 9:45. We will discuss the answer. So every time I can't tell that write the answer. So it is your interest. I can't do anything here. So if you write, you will get the confidence that I am trying my best. So guys, so first of all, here we need to identify the keywords. So here removal is first keyword. So here patient is coming for removal of previously implanted Medtronic pump and catheter due to so possible infection. So due to infection, physician is going to remove that implanted Medtronic pump. So one more keyword is the back was incised. So back denotes it is prone position. So next dissection was carried down to the previously placed catheter. There was evidence of infection with some fat necrosis in which cultures were taken. The intrathecal portion of the catheter was removed. So this is also one keyword. Next, the pump pocket was inside and the pump was disconnected from the anterior fascia. So dissected is also one keyword. A 7 Blake drain was placed in the pump pocket through a stab incision and secured the skin with interrupted proline. So here physician has removed the pump and he placed the drain. The pump pocket was copiously irrigated with saline and closed in 2 layers. So basically the procedure is here patient has previously implanted Medtronic pain pump. But due to here physician told possible infection, but in the operator report he has confirmed. So there was evidence of infection with some fat. So based on ICD guidelines, if the physician states evidence, we can take in the outpatient setting. But to suggestive of, consist of, look those words we can't take. Here evidence of means we can consider it as a confirmed diagnosis. So here patient has the infection of the catheter location. So now we will check the answers. So first of all, as soon as you see the question, you need to understand the keywords here. So we will check 62365. 62365. So removal of subcutaneous reservoir or pump previously implanted for intrathecal or epidural infusion. So what is next? 62360. So implantation or replacement. So directly we can eliminate 62360. Why means here our physician has removed the pump, not implanted or replaced. So directly B is wrong answer. So we can check 36590. So it is removal of central venous access device. So here physician removed the pain pump, not central venous access device. So here D is also wrong. So next we are left with 62365. So here physician has removed removal of subcutaneous reservoir or pump previously implanted for intrathecal epidural infusion as well as 62355. This is for reservoir removal of reservoir or pump. So we can check 62355. So this is removal of previously implanted intrathecal or epidural catheter. So if you see here, physician has removed catheter here and also he has removed pump pocket and pump. Dissected pump was disconnected means he removed the pump. So based on this report, physician has removed pump as well as the catheter. So we need to code 2 codes. So here our answer is 62365 as well as 62355. So we need to remember that if the physician removes pump and the catheter, we need to code 2 separate codes. So here 2 T85.79 into A is for infection of the catheter. So I hope everyone got the understanding. If you don't get it, just to ask me, I will explain one more time. So Srinivas Reddy, I think you got answer now. If you don't get the answer, please ask me. I will explain one more time. So it is not A. Basically, 623 first you have seen, I think, first code. You have not seen 62350. For your purpose, we can check 62350. What is this? Implantation, revision, or repositioning of tunnel. So basically, in our question, it is pump and catheter are removed. So here 62350 is implantation, revision, or repositioning. So here physician has removed the catheter or pump. He did not implanted the pump. So here we need to code 62365 as well as 62355. 62365 for catheter, 62355 for catheter, 65 for pump. So I got everyone got the answer now. So first you need to identify the keywords so that you can answer these questions easily. So you need to have like these keywords: first, second, third, fourth, 5, 6, 7. You need to understand the keywords selection. If you know that, you can write it easily. So next question. The patient is a 53-year-old gentleman who was noted to have progressive gait instability over the past several months. Magnetic resonance imaging demonstrated ventriculomegaly. It was recommended that the patient proceeded forward with right frontal ventriculoperitoneal shunt placement with Codman programmable valve. What is the correct code for this surgery? So 62220, 62223, 62190, 62192. It is very easy. You can do it fast. Now it is 9:52. We can start discussion of answers 9:55. So all of you write your answer in the chat box. So there are no or negative marking in this session. So you can write whatever you want. So first you need to understand the keywords. Then you can do it easily. Rohit, I don't think you need these sessions. I'm kidding. Your wish, you can visit. Great, Rohit, great. Even I too doing the same thing. In order to help the coders, we have started this session. So even I am also motivating the people to use this free live session. So you know, in India, no one is providing free sessions except me. It is our responsibility to educate the people and need to share the knowledge. But it will useful somewhere. But instantly it is not useful. But sometimes it will be useful. Hi Pravalika, good evening. So guys, so for this question, most of the people wrote the correct answer. So we no need to check correct answer, I think so. So anyway, we'll check. Anyway, all the codes are nearby only, na? We can check. 62190, we will check first C. 62190992. So here we will check the keywords first. The patient is a gentleman. Here gait instability, imaging. Ventriculomegaly means it is enlargement. So patient's ventricle is enlarged. So what happens here? If there is a ventriculomegaly, physician will insert the shunt. So that shunt will drain the fluid into the peritoneal area. So that's why his name is starting point is ventricle and ending point is peritoneal cavity. So we will call it as ventriculoperitoneal shunt. So here basically physician has like inserted ventriculoperitoneal shunt. We can check that 62190. So see, this is very confusing question while writing the CPC exam. So see here, creation of shunt, subarachnoid, subdural, arterial, jugular or auricular. 90 is for subarachnoid, subdural, peritoneal, plural or other terminus. So you no need to get confused using the peritoneal word here. In our question, our shunt is ventriculoperitoneal, not only peritoneal. So we can't choose this 90 and 92. So what else? We have 62220. So we can directly eliminate 90 and 92. Why we are eliminating? So here ventricle is not mentioned in these two codes. So we can see here 62220 creation of shunt ventriculo-arterial, jugular, auricular. So this is also wrong. So here there is no word peritoneal. So 62220 is also wrong. Next we have creation of shunt ventriculoperitoneal, plural, other terminus. So based on our code description as well as the procedure, 62223 is the correct answer. So we'll go ahead and mark it as the correct answer. Okay guys, we will go ahead with third question. Question 3. What is the CPT code for the decompression of the median nerve found in the space in the wrist on the palmar side? A 64704, B 64713, C 64721, D 64719. So now it is 9:58. We will start discussing the answer at 10:01. 10:01. Start searching guys. Yeah, Pravalika. Good to see you here. So Drakshayani, you need to write the answers. Supriya is writing. Parimala is also trying to write. Azra is also participating well. And Kushum Singh, try to answer the question. And Ethan Swald, please write the answer in chat box. And Dip P87, please write the answer. And Dhanasri Jadhav, you have the CPT book, write the answer, Dhanasri. So it is very good for you only, not for me. Yeah, these all are only. Just all of you try to write the answer. There are no negative markings here. Anyway, these are very simple only. But while writing CPC exam or while live coding also, we need to compare code description with our question. See here, we have seen multiple number of shunts are there. So it is bit confusing. So that's why we need to clearly check it is a ventriculoperitoneal shunt, not only shunt, peritoneal shunt. So next week onwards, we will use 2023 books. So all of you try to write the answer. So it is very easy only, guys. There are no negative markings. So yeah, most of the people wrote, "Hi others, good evening." So most of the people wrote correct answer only. But anyway, it is better to discuss once. So some things, if we discuss multiple times, we can remember. So we can check 64704. First, what happened here? Decompression. Decompression of the median nerve found in the space in the wrist on the palmar side. So here physician has decompression. So compression means it is like pressing. So decompression means here physician will remove pressure on the median nerve. So here decompression of the median nerve. So here physician has released the obstruction along with the nerve and he released from adhesions. So we can check the answer. First one 64704. So in spine procedure also, if you find a decompression means, so physician is clearing the way the nerve enroots. So first one 64704. So here neuroplasty, digital one or both same digit nerve of the hand or foot. So here this is a neuroplasty, not decompression. Neuroplasty means plasty means repair. Neuro means nerve. So it is like nerve repair of nerve of hand or foot. Here physician did sorry code description does not contain median nerve. So 64704 is wrong answer. So we will check 64713. What is 13? So this is brachial plexus. Neuroplasty major peripheral nerve, arm or leg open other than specified. This is brachial plexus. So this is also wrong. So in our question there are no brachial plexus. So this is also wrong. Next one 64719. So this is ulnar nerve at wrist. So don't get confused. In our question we have medial nerve, not ulnar nerve. So 64719 is also wrong. So if we check 64721, it is showing medial nerve at carpal tunnel. So medial nerve at carpal tunnel 64721 is correct. Usually we'll call this procedure as carpal tunnel release. So in our code books we need to remember that. So whenever physician does the decompression of medial nerve, physician is doing the carpal tunnel release. So he is removing the obstruction towards the medial nerve. So you need to remember this is carpal tunnel release. So we'll go ahead with fourth question. A 5-year-old Hispanic male has a chalazion on both upper and lower lid of the right eye. He was placed under general anesthesia with number 11 blade. The chalazion was incised and a small curette was then used to retrieve any granulomatous material on both lids. What CPT code should be used for this procedure? 67801, 67805, 67800, 67808. So guys, now it is 1004. We can start the answer checking at 1008. So I will give you 3 or 4 minutes. Meanwhile, you can try that. So first try to identify the keywords. So in this situation, you need to know the Calagian also. So guys, no one is master in any subject. So even I can search few words. As these are not routine, we need to search Google for meaning. What is chalazion first? We need to identify the condition first. Then we can understand what might be the procedure physician is going to do. You need to understand the diagnosis first so that we can understand the procedure easily. So what is a chalazion? Chalazion is a red bump on your eyelid. Yeah, I got it now. So next time you can remember that it is a red bump. So no one will restrict you to use the Google. You can use Google as much as possible with you. So it is collagen is red bump on your eyelid. Then you need to think what are the procedure physician might be does for this collagen. So then you can compare your thinking with our code description. Yeah, yeah, this is very easy only, guys. So anyway, good job. So basically, collagen is like a pimple type thing. So on the eyelids. So now we can check the answer. So what I got here, D, A, B, mixed answers we got. So first we will check 67800. 67800. So first we will check the description so that we can understand. So fire male Hispanic male has a color both upper and lower lid of the right eye. So here these are the keywords. So thank you, Preeti. So now here we need to understand that patient has two collagen, both upper and lower lids. This is one keywords, and he was placed under general anesthesia. This is also one keyword with number 11 blade. The collagen was incised and a small curette was then used to retrieve any granulomatous material on both lids. So here physician did the incision and he used small curette to remove the tissue. So now we can check. So here only like it is incision only. So we can check the code descriptions. First we will check 67800. So excision of collagen single. So as physician, this is for only single collagen. But as per the code description, sorry, as per our question, we have two collagens. So both upper and lower lids. So 678 00 is wrong answer. Next, you will check 67801. So here 67801 is for multiple same lead. But based on our question, we have multiple but both are on different leads. So 67801 is also wrong answer. So next we will check B 67805. So multiple different leads. So this is correct, but here we need to understand one keyword. So here under general anesthesia, physician has performed this procedure. So here we need to use 67808. If you see the code description, excision of the collagen under general anesthesia and are requiring hospitalization, single or multiple. If physician will use General anesthesia with single collagen also we need to use 67808. If physician will use under general anesthesia and multiple collagen also we need to use 6708. So like these questions looks like simple only but bit confusing. So while like attempting CPC exam you need to take caution while writing these questions. So women see all are resembles. So you may get confused. So just you need to compare our question with the code description. So anyway, I think most of the people write correct answer. No worries here. Yeah. So next question. MRI reveals, sorry, question number 5. MRI reveals, MRI means magnetic resonance imaging reveals patient has cervical stenosis. It was determined he should undergo bilateral cervical laminectomy at C3 through C6 and fusion. The edges of the laminectomy were then cleaned up with a kerison and foraminotomies were done at C4, C5 and C6. The stenosis is central. A fasciectomy is performed by using a burr. Nerve root canals were freed by additional resection of the facet and compression of the spinal cord were relieved by removal of the tissue overgrowth around the foramen. What CPT code is used for this procedure? We have 63045 and 63048 with 50 modifier for both codes. B 63020 50 modifier, 630-635 50 modifier, 63035 50 modifier, C 63015 50 modifier, 63045 63048 times 2. So guys, this is bit difficult. So now it is 10:12. I will give you 5 minutes for this question. It is very difficult. You need to identify the multiple keywords here. So now it is 10:13. We will start discussing the answer at 10 18. If I get the answers, I will start. So meanwhile, all of you click on like button. So it will motivate me to provide like these sessions frequently. So all of you try to write the answer. So there are no negative markings here. Yeah, good Dhanasri, keep it up. And Pravalika is also trying well. So Rohit also trying well. As spine procedures are little bit complex. So if you write the answer also, you can think your answers one more time. We have enough time to think about this question. So you need to understand that we need to have the code description with all the keywords. First keywords is the, if you know the correct keywords, you can write the answer easily. So I got to few correct answers, few wrong answers. So I think I need to wait for 3 more minutes. So guys, so we are providing CPC, CIC and CCS trainings also along with inpatient IPDRG coding and also CPMA training. So if anyone interested for these trainings, please let us know by sending your details to vincentmedicalcoder@gmail.com. So you will get nearly 10 to 15 mock tests as well as the availability of mine at any time. So whenever you struck with any answer or question, I will be available to assist with you. So if anyone is interested to undergo CPC or CCS, CPMA, just contact using Vincent Medical Coder at gmail.com. So if anyone is trying for IPDRG coding, you can attend. So along with training, we are providing 3M access also. So you can use 3M in order to practice your trainings. Hi Shruti, good evening. Hi Kiran, good evening. So please click on like button. The people who did not do now, so it will motivate me to create like this session as much as possible with me. So there is no problem for you to click on like. Yeah, thank you, thank you. Now I got 12, 13 likes. I think nearly we have more people as nervous system is complex chapter. I think most of the people are participating in this session. So I think all you guys are in fast coder 21 WhatsApp Telegram groups, na? So if you are in those groups, other than these sessions, we are providing more valuable PDFs in those groups. So entertain or ask your friends to join in our WhatsApp groups. Other than these videos and these sessions, we are providing some important PDFs also. So like some very, very important keywords. So ask your friends to join on our WhatsApp groups or Telegram groups. So they will get updates. So guys, now it is 10:18. We will discuss the answer. If you don't read correctly, no need to worry. Yeah, spine procedures are little bit complex. So first we will check 630. So first of all, we will check our keywords. So what is the diagnosis here? Cervical stenosis. It was determined he should undergo bilateral cervical laminectomy. So here laminectomy means here physician will remove the lamina in order to reduce pressure on the cervical spine, and fusion also. So the edges of laminectomy were then cleaned up with kerison foraminectomies were done at C4, C5 and C6. So laminectomy means removal of lamina. Ectomy means removal. Lamina means physician has removing laminectomy here. So he removed lamina. So foraminectomy means here physician is making otomy means incisions. So he is creating incision on foramina. Were done at C4, C5 and C6. So laminectomy one keyword, foraminectomy one keyword, and here stenosis is also one keyword, and here fascicectomy is also one keyword. So physician has performed multiple procedures in this session. So physician performed laminectomy, foraminectomy and fascicectomy. Fascicectomy means removal of facet joint. So now we will check. Here indirectly, this is also decompression. So here spinal cord was removed by removal of tissue overgrowth. So as here cervical stenosis is occurred due to like tissue overgrowth. So here physician decompressed cervical area by removing the overgrowth here. So this is also we need to understand. So we will check the answers now. First we will check B 63020. So basically these all the materials provided us by Srinivasa, sorry, Shivakumar. He did not attend this session. So if anyone has the material, please provide to me. So I will use those materials in order to help others. So if you see laminotomy with decompression of nerve root including partial fascicectomy, foraminotomy under excision of herniated intervertebral disc. So here our keyword is laminectomy, but in code description it is laminotomy. So usually we'll call it as hemilaminectomy. So our keywords are different here. Here laminectomy, here laminotomy. So directly we can eliminate 63020 code. So here we can eliminate B here. Next one we check 63015. So what is this? Laminectomy with exploration and or decompression of spinal cord under cauda equina without fascicectomy, foraminotomy and discectomy more than 2 vertebral segment cervical. So here based on our code description, physician has performed fascicectomy, but as per code description without fascicectomy. So directly 63015 also incorrect. So we can eliminate answer C. So we can check other one. So what is next? 630, we will check A, 63045. So what is 63045? Laminectomy, fascicectomy and foraminotomy, unilateral or bilateral with decompression of spinal cord, quada equina and or nerve roots. Examples, spinal or lateral stenosis, single vertebral segment, cervical. So basically what happens here? So 63045, we can't give 50 modifier. Why means our code description itself includes unilateral or bilateral. So if physician has will perform laminectomy, fascicectomy and foraminotomy on unilateral side also we will use 63045. Bilateral side use also we need to use 63045. So here answer A contains 63045 50 modifier, 63048 50 modifier. So as the code description is having bilateral default, we can't use 50 modifier here. So answer A is also correct. So we are left with 63045 and 6304 into times 2. We will check that. Yeah, correct here. 63045 laminectomy, fascicectomy and foraminotomy. So here there is no modifier in D. So this is correct. We can check 63048. So each additional level vertebral segment cervical, thoracic or lumbar. So whether it is cervical, thoracic or lumbar, we need to use 63048. So first of all we need to identify the levels here. So yes, three levels. C3 to C4, C4 to C5, C5 to C6. So here physician has performed procedure on three levels. So 63048 times 2. We need to use 63048 2 times. Why means it here code description contains each additional vertebral segment, not for multiple segment, each. Each means we need to code multiple codes. If physician performs C7 also, that time how do we code that one? If physician performs C3 to C7, how do we code? Same scenario but levels are different. Just write in the chat box. So first of all you need to check the. So my question here is same procedure, question number 5. Yeah, good. I got correct answers. No, Pravalika, you need to check the my answer first. C3 to C7, not C6. If it is C6, your answer is correct, Pravalika. I am asking first of all you need to identify the levels. How many levels physician is performing the procedure? So identify C3 to C4 one level, C4 to C5 one level, C5 to C6 one level, C6 to C7 one level. So completely we are having 4 levels. So here how do we code? 63045 for first level, and as per the code description we need to code 63048 multiple times based on the levels. Yes, Kiran, Adra is correct, Shruti is correct. So mostly all of correct. So you need to understand the keyword here, each additional. Using this, if you understand this keyword, you can write the answer easily. So most of the people got the answer. So no worries, Pravalika, you need to understand. First, we need to identify the levels here. So we have 4 levels means we need to code 4 codes. It's when we will go ahead with question number 6. So an extracapsular cataract removal is performed on the right eye by manually using an iris expansion device to expand the pupil. A emulsification unit was used to remove the nucleus, and irrigation and aspiration was used to remove the residual cortex, allowing the insertion of the intraocular lens. What CPT code is reported? 66985, 66984, 66982, 66983. Now it is 10:27. It is very easy only. We will start discussion at 10:30. So I hope everyone write correct answer for this. Meanwhile, if you write the answer, just check Google for what is extracapsular cataract. So we have in CPT extracapsular and intracapsular. So we need to understand the difference between both. So whenever you like if you do live coding or CPC, just to try to know the anatomy, it is very useful for us. So now we have 2 minutes. So now we have 1 more minute. Yeah, most of the people write the correct answer. So all are performing well. So if you write also, we can discuss. Not a problem for us. So if anyone has the material, please send it to me. I will use those material for these sessions. Hi Marina, good evening. Yes, Mahesh, I will be available all the time, but we are having the team, so we will provide CPC training. I will be available 24/7 for you if you join. So whenever you struck, I will be available for you. not in daytime. So evening times I will available for you. So now it is 10:31. Sorry guys. So we will go ahead with the answer. So first we will check 66985. So what is this? Insertion of intraocular lens process is not associated with concurrent cataract removal. So here we need our keywords are extracapsular cataract removal and also laterality right eye. So in this material we don't have any lateralities. So you need to understand lateralities also. So iris expansion device is also one keyword, and phacoemulsification is the procedure, exact procedure, and to remove the nucleus, this is also one keyword, and irrigation and aspiration was used to remove the residual cortex following the insertion of the intraocular lens. So basically what happened here, physician has removed the cataract. Cataract means opacification of eyelid, eyeball. So physician has removed cataract as well as inserted intraocular lens at the same time. So we will check this answer. What is 66985? Insertion of intraocular lens process is not associated with concurrent cataract removal. So 66985 for only insertion of intraocular lens, but in our procedure cataract is also removed and lens inserted. So 66985 is wrong. So we will check 66984. What is 66984? So extracapsular cataract removal with insertion of intraocular lens process is manual or mechanical technique without endoscopic cyclophotocoagulation. But here we have one keyword which is iris expansion device, which is not included in 66984. So we can't select 66984, which is a, while coding ambulatory surgery, we will consider it as a normal procedure. So in cataract procedures, we have two types: normal cataract removal and insertion of lens, as well as complex cataract removal with insertion of lens. So we will check 66983. Intracapsular cataract extraction with insertion of intraocular lens processes. What is this? Here also there is no keyword mentioned, which is iris expansion device. So we will check 66982 now. So if you see here, extracapsular cataract removal with insertion of intralens ocular lens processes, one stage procedure, manual or mechanical technique, irrigation and aspiration or phacoemulsification. This is common for 66982 and 984. Complex, from here it differs from 66984. So complex, requiring devices or techniques not generally used in routine cataract surgery. These are the common examples. So our keyword in our question is iris expansion device, which is included in 66982. So here our correct answer is 66982. Yeah, 66982 is the correct answer. This keyword iris expansion device is included in 66982. So we'll go ahead with question number 7. I think most of the people wrote correct answer for this question. Congrats guys. Keep it up. No worries Rohit. So an infant who has chronic otitis media in the right and left ears was placed under general anesthesia, and a radial incision was made in the posterior quadrant of the left and right tympanic membranes. A large amount of mucoid effusion was suctioned and then ventilating tube was placed in both ears. What CPT and ICD-10 CM codes are reported? 6943650, 6943650, 69433 69421. So you need to take caution here. I think you need to use ICD code also here. So now it is 10:36. We will discuss the answer at 10:40. So I will give you 4 minutes. 5 minutes. You need to check the ICD code also here in order to write the correct answer. Start, guys. We will discuss the answer at 10:40. You need to check the ICD also here. So first try to remember, like, identify the keywords here. Then only you can write it correctly or code it correctly. So if anyone would like to take CPMA training, which is good for the people who are trying to become auditors. So we are going to start next batch from next week. So if anyone is interested, send your details to vincentmedicalcoder@gmail.com so that you will become CPMA proficient and you will get more salary compared to the people who are having CPC certification. So if anyone wants CPC training also, we have started our trainings. April in first weeks we are going to start new session for CPC new batch. If anyone is interested, you can send your details to vincentmedicalcoder@gmail.com. Guys, can you see the question? Oh, sorry, Parimala, it's my mistake. Yeah, go ahead now. Yeah, no worries. You guys can write easily. So, Kusim Singh, you are not writing any answer. Try to write whatever you know. No need to worry about whether right or correct. And Parimala is participating well. Deep P87. Sandeep, you need to write the answer. Sandeep. Srinivas Reddy is also participating well. Dhanushri Yadav participated half of the session. Dhanalakshmi and Rohit is evergreen. He will participate at any time. Srinivas Reddy is good. Kusum Singh and Ithan World try to answer the question in the chat box. So there are no negative marking here. Adira Sultana is writing good. Supriya is also doing good. So next, Pravalika is also doing good job by learning new things. Thank you, Dip P87. Thank you very much. Others, Drakshayani. Guys, so this session is not only useful for the CPC aspirants, this session is useful for the The people who are trying to enter into surgery field, this is very useful. So you can encourage your friends to attend these sessions. Yasin is so performing well. Marina is also doing good. Shruti is also doing good. Kiran. Okay, guys. I think I called most of the people. So all are doing good. Here our answer is A. We can check answer A here. So here we need to identify the keywords. Otitis media and right and left ear. So both here placed under general anesthesia. So keywords here. Then here physician has performed incision. So incision means it is a open procedure. Posterior quadrantal, left and right tympanic memory, large amount of mucus effusion was suctioned and then ventilating tube was placed in both ears. So this is the most important keyword here. Ventilating tube was placed. So here indirectly we can call it as insertion of ventilating tube. So we will check the answers. The 69421 first. So 69421 is myringotomy including aspiration and/or asphyxiation tube in patient requiring general anesthesia. So here our keyword is not myringotomy. So our keyword is ventilating tube insertion. So there is no word myringotomy in our question. So directly we can eliminate 69421. So what is next? Next is 69433. Yeah. What is 69433? Yeah, anyway, it is nearby only. We can directly do it. So, tympanostomy, local or topical anesthesia. So, here physician has done tympanostomy. Ostomy means it's artificial opening. So, here physician did not do any creation of artificial opening. So, directly we can eliminate 69433. So, whenever you see ostomy word, it is like artificial opening creation. Usually we will see in digestive systems like colostomy, ileostomy, jejunostomy like that. So mostly we will use ostomies in digestive system coding. So we have removed 69421, 69433 are eliminated. So if you see these two questions, CPT question is CPT is same. We check 69436. So tympanostomy requiring insertion of ventilating tube, general anesthesia. So we need to identify here that 69433 is for local or topical anesthesia, 69436 is for general anesthesia. So based on our question here, physician has used general anesthesia. So we need to consider 69436 is the correct CPT code. So but in this question, based on ICD code, we need to identify the correct code. So here based on ICD, we can use S6533 is the correct answer. So here our answer is A, 69436 50 modifier as physician has performed on right and left ears, and S6533 is for chronic otitis media. So I think most of the people wrote the correct answer for this. Well done, guys. Well done. So we'll go ahead with question number 8. A craniectomy is being performed on a patient who has Chiari malformation. Once the posterior inferior scalp was removed, a C1 and a C2 laminectomy was then performed. The right cerebellar tonsil was dissected free of the dorsal medulla and a gush of cerebrospinal fluid gave good decompression of the posterior fossa content, which CPT code is reported. A 61322, B 61345, C 61343, D 61458. So now it is 10:45. We can, sorry, 10:46. We can discuss the answer at 10:49. So go ahead, guys. Try for this answer. Just comparison, that's enough. There is no hard work in CPT, guys. It is very easy. I passed my exam without taking any training. Just you need to understand with or without, or and all those things. So you have 1 more minute to write the answer. So here we are getting mixed responses. No worries. We can discuss correct answer. Good, Drakshayani. Keep it up. You are doing good job. So you have 1 more minute. So today anyone is trying to go UAE. Today we have published one video. Best tips to find medical coding job in UAE. Watch that video. It is very useful if anyone is planning to go UAE. So next week we are planning to put best tips to find medical coding job in Canada. So if anyone is trying to go Canada, you can watch the session next week. So already our channel is having best tips to find medical coding job in United Kingdom. So we are going to start. We have finished United Kingdom and Dubai and UAE. Now we are going to publish Canada, USA and Australia. So if anyone is interested to visit those countries, watch those videos. So now it is 10:49. So we will dive into our question. So what are the keywords here? First is craniectomy. Is being performed on a patient who has Chiari malformation. So this is the diagnosis. Once the posterior imperial scalp. So posterior means it is on backside. Inferior scalp was removed and a C1 to C2 laminectomy was then performed. The right cerebellar tonsil was dissected free of the dorsal medulla and gush of cerebrospinal fluid gave good decompression of the posterior fossa content. So here also physician has removed burden on the like C1 to C2. So C1 means cervical spine. So we'll go ahead with what is first 61322. So 61322 craniectomy or craniotomy decompressive with or without duroplasty for treatment of intracranial hypertension without evacuation of associated intraparenchymal hematoma without lobectomy. So our code description is not resembles our question. So our question does not have any Basically 6132T is for treatment of intracranial hypertension, but our patient has Chiari malformation. So directly we can eliminate 61322. So we can check 61345. So as this code is for treatment of intracranial hypertension, but our patient does not have intracranial hypertension. Next we will check 61345. So what is this? So here other cranial decompression, posterior fossa. So basically 61345 is continuation of 61343. I don't think so. That is different. This is different. So other than cranial decompression, posterior fossa. So this is wrong answer. Next, what is that? 613, 61458. Craniectomy suboccipital for exploration or decompression of cranial nerves. So this is suboccipital. So our code description does not have suboccipital keyword. So that is also wrong. So we will check 61343. Craniectomy suboccipital with cervical laminectomy for decompression of medulla and spinal cord with or without dural graft. So if you see here, based on our diagnosis also, we can identify the CPT code. If you see here, 61343 for Chiari malformation. So here our patient is having Chiari malformation. So directly we can go and select 61343 as the correct answer. So try to remember that using diagnosis code also we can identify the CPT procedures. Like for example, if you take condyloma, you can find the condyloma in CPT book. So directly you can code that CPT procedure. For example, if the patient has trigger finger, we have directly trigger finger diagnosis code in CPT book. You can directly code trigger finger using the CP diagnosis. So all of this, after discussion, our answer is 61343. So what is next? Question number 9. So under fluoroscopic guidance, an injection of a combination of steroid and analgesic agent is performed on T2, T3, T4, T5, T6, T7 and T8, T9 on the left side into the paravertebral facet joint. The procedure was performed for pain due to thoracic root lesions. What are the procedure codes? 64479, 64490, 64520, 64490. Guys, this I think this is a bit complex. So we will start discussing the answer at 11 o'clock. Now it is 10:53. So if I get the answers before that, we'll write the answer. So you are asking why 61345 is wrong. So here there is no mention of Chiari malformation. So as I told you before, based on ICD-10 CM diagnosis also we can code the CPT procedure. If you see here, our patient has Chiari malformation and 64313 is also having Chiari malformation. So we need to select 61343 for CPT code. So I have Parimala, you got this answer now. So you need to code CPT code using the diagnosis also. So you need to compare diagnosis also here. So I think Parimala, you got this answer and try for this complex question here. Question number 9. Try this answer now. We will start discussing answer at 9. Sorry, 11 o'clock. Yes, you need to know the comparison. How to, first of all, you need to identify the keywords, then comparison. That's enough. Yeah, Yasin and Kiran are doing good. Great guys, you wrote, most of the people wrote the correct answer. So basically posterior fossa means it is like small space in the skull and posterior. Posterior means back side of the skull. So you need to remember that fossa means space. Posterior fossa means back side of the skull. So based on the location you can decide. So guys, so most of the people wrote the correct answer. So we can discuss the answer now. So first we can check. So what is first keywords under fluoroscopic guidance? Your physician has performed injection. So what is the injection? Steroid and analgesic. So usually physician will use steroids for pain management. So your injection performed for pain management performed in T2 to T3, T4, T5, T6, T7, T8, T9. So completely 4 levels. So next on the left side into the paravertebral facet joint. So here we need lateral is also very important. So left side and paravertebral facet joint. The procedure performed for pain due to thoracic root lesion. So as we discussed, this is the pain control or pain management procedure. Rohit very know more about this one as he is doing pain management coding. So we will check 64479 first. See here, what is our type of injection? Paravertebral facet joints. So what is 64479? This is transforaminal epidural injection. So here approach is wrong or different. So directly we can strike 64479 which is A. So ours is paravertebral facet joint, not transforaminal. So next we will check 64490. What is 64490? So injection, diagnostic or therapeutic agent, paravertebral facet joint with image guidance, cervical or thoracic. So this is correct. We can check. So 91 for second level, 92 for third and any additional level, and 77003 is for fluoroscopic guidance. But what happens here? Based on our code description, fluoroscopy is included in 64490. We no need to code separately. See here with imaging guidance, fluoroscopy or CT. So we no need to code separately. So but our B is having fluoroscopy separate code. So directly we can eliminate B as fluoroscopy is not needed to code in this 64490, and we can check 64520. What is 64520? So in spinal procedures, this imaging guidance is very important. So we need to check imaging guidance 64520. So here lumbar or thoracic, paravertebral, sympathetic. So what is this 64505 injection anesthetic agent, not pain management agent. So our pain management agent is here steroid and analgesic. So but based on this code description, it is anesthetic agent. So directly we can eliminate 645. What is this? 64520 na? Yeah, lumbar or thoracic. So our physician has injected steroid and analgesic, not anesthetic. So 64520 is wrong answer. We can directly eliminate this, and we will check 64490. So first, in order to code this, we need to understand the levels here. So we have totally 4 levels: 2 to 3, 3 to 4 to 5, 6 to 7, and 8 to 9. So we have total 4 levels. So 64490 is for first level, single level. See here, cervical or thoracic. 64491 is for second level. Also, we have remaining 2 levels. So 64490 is for third and any additional level. So if it is 10 levels also, we need to code same 64490, 64491, 64492. Third or any additional level. For example, if the patient has 5 levels, how do you code? Just write answer in the chat box. So here in this question we have 4 levels. What if the patient has 5 levels? How do you code? Write in the chat box. So 5 levels also we can code only D. 64490, 64491, 64492. As 92 description is having third and any additional level. So 4 or fifth also we need to code same. Yeah, Supriya, you are correct. Shruti correct. So all of you correct. Same answer we need to code, irrespective of the levels injected because of this code description. So we are going to learn last question of the week. So question 10, procedure bilateral lumbar medial branch block under ultrasound guidance for the L3, L4, L5 medial branches injecting the L4, L5, L5S1 facets for diagnostic and therapeutic purposes. So the patient was placed in the prone position and automated blood pressure cuff and pulse oximeter applied. The skin entry points for approaching the anatomic target points are the bilateral segmental medial branches or dorsal ramus of the, sorry, I will make it clear. So branches of dorsal ramus of L3, L4, L5 were identified with it a 22.5 degree from an ultrasound view and marked. Following through chloroprep preparation of the skin and draping and 1% lidocaine infiltrates the skin entry points and subcutaneous tissue. A 22 gauge 6-inch spinal needle was placed under ultrasound guidance for the L4, L5, L5S1 facet joint. At each joint, 1 ml consisting of 0.5% pipecaine and dipomedrol was injected. A total of 80 milligrams of dipomedrol was given in both sides, where CPG code should be used. So guys, 061 60 50 64493 64493 061 60. So it is bit complex only. Now it is 11:06. We will discuss the answer at 11:10. So actually this question was asked by Shivakumar. So I thought he will come today, but he did not attend. So he has provided this material. So if any one of you having this material, please send it to me so we can use this for our sessions. So we have 1 more minute with complex only. So just we need to compare our question with the code description. That's enough. So Shivakumar is very good. He is learning and helping others. So you guys need to take motivation from him, like Rohit and Shivakumar. So if anyone has the material or difficult subject, you can provide me that material so we can look it, and I will try to explain in clear explanation. So now it is 11:10. We can discuss the answer. So we can check first one. So guys, directly we will go to answer to this question. Why means I don't have that book, so I can't search temporary codes. Like here we can check whatever is possible. So we will check 061216T. So 0216. So we can do one thing. We will leave it this question for next week. So we will learn next week this one. So but the answer is D. D is correct answer. We can check 64493 once. So we will get 64493. So here injection, diagnostic or therapeutic agent, paravertebral facet joint with image guidance, lumbar or sacral, single level. So what is our question? Bilateral lumbar medial branch block under ultrasonic guidance for the L3, L4, L5 medial branches. Okay, guys, we will check this answer on next week. No need to worry. So I need a complete book, but I have only half of the book, so I can't do anything. Next week we can see that one. So just remember me next week. So now it is question time. If you have any questions, you can ask me. So I think my system has the problem. So if anyone has the question, guys, if you has any doubt, yeah. So Shruti, currently I don't have that book. Next week we can discuss that answer. So if you guys teaser for add-on course in VRG modifier, especially 50 and 50. Yeah, we can discuss next week, Supriya. So guys, anyone is here? So I have network problem, so I can't. So thank you guys. Thank you very much.